New to Proov? No problem. We are always happy to answer your most frequently asked questions, so you feel confident using Proov to get the full picture of ovulation. First question is about the baseline test. People often ask, why do I need to take a baseline and when do I need to take it? Well, it's important to know what your negative looks like. You'll take a baseline after your period, but no earlier than cycle day 5. Expect it to be negative because at this time in your cycle, PDG levels are naturally low. And keep in mind, with the Proov PDG test strips, even a very faint line is a negative. And if your baseline negative seems really light, it's often nothing to worry about. Baseline negatives come in all shades and you only need to take one every 6 cycles. How do I determine my peak day? Not to be confused with your LH surge peak. Your peak fertility day is defined as the first day you get a positive LH test or observe fertile cervical mucus. Use an ovulation test like the Proov LH test that come in the Proov Predict and Confirm kit to determine your peak fertility day. If LH tests don't work for you, we recommend using cervical mucus monitoring or a fertile window tracking device of your choice. When do I Proov? You will Proov days 7, 8, 9, and 10 after your peak fertility day. This is a time in the cycle when PDG levels are expected to be high. Ideally, you want all 4 tests to be positive. However, in some cases, if you get 3 out of 4 positives, that's okay too. There will be small dips in PDG, which can be totally normal since progesterone fluctuates hour by hour. If you get a negative on day 7, 8, or 9, but positives the rest of the testing window, that is still considered a successful ovulation. But if you get a negative on day 10 and a positive the rest of the testing window, it is possible that PDG may be falling a bit too early to call ovulation truly successful. And if you get 2 negatives or more, you will have great data about your cycle and your body to discuss with your doctor. Do you have any more questions? We are always happy to help.